Thank you, everybody. That was a great talk and a ton of great pointers there. So what dovetails nicely, I think, with some of the questions that came up about what you're looking for from your rotation, which is ideally some great experiences and some great learning, but the bottom line is you want that letter that's going to be sort of the capstone, if you will, of your application. This is one of the things where it just feels so out of control and beyond you, but I think we have a pretty good system in emergency medicine where the path forward for getting these letters and the value of these letters is maybe a little more defined than in other specialties. And I hope to help you understand the process a little bit, but also maybe to dispel a little bit of your anxiety about it, because it is quite doable. So I want to talk a little bit about the background of the SLOE and what it is and why we use this template as programs and the value of it. This is sort of the prototypical letter that you get when you don't use a template, all right? Sometimes you have a really experienced, engaged letter writer, but most often, just for those of you in back who can't read it, this is the generic letter. It gives me great pleasure to write a letter of recommendation for blank. I worked with this person at this time. They're hardworking, good knowledge, clinical skills. She proved herself to be competent, enthusiastic, carries out her duties with great sincerity and commitment, punctual, intelligent, good relationship with her patients. I strongly recommend her for any position. Would be an asset to any institution. From reading this letter, I don't know anything more about this person, about who they are, that would help me pick them out of a lineup, why I should pick her as opposed to the next application behind her. This is the kind but benignly generic letter that has no differentiators in it and none of the particulars about what you're going to be like to be a resident in my program that I'm looking for as a program director. I want to know the things that distinguish you in your strengths and maybe just keeping my eyes open, the things that we might need to work on. Not necessarily about the kiss of death, because no one is perfect, but I want to try to know you as a person. And this is the genesis of the SLOE, because a letter is really about the person's experience. If you write a ton of letters, you will intuit a lot of the things in the SLOE and put them in there, but that's 20% of letter writers. So the SLOE gets over that, it equalizes the playing field, if you will, in terms of the experience, but it really focuses people on, what's the nature of their relationship with this person. Were you the clerkship director and you've known them for 4 years, or did I do 2 shifts with you? It makes a total difference in the weight of the letter, and the SLOE makes that clear, and also it really emphasizes your strengths and weaknesses as a student and gets some of the flowery but useless prose out of the way. And that's the standardization part of it. So this will level the playing field across clerkship sites, and will answer the questions that we want to know, and will really help differentiate people, because we understand that your boards are important in the sense that they predict one thing: are you going to pass your specialty board certification test? But it's not meant as a discriminator between residents who are good and great. It's not predictive of anything. We know that. So we really look at this letter as our opportunity to recognize the people who are uniquely suited for our specialty and are going to be awesome and well suited for our program. And it's going to give us that ability to have those discriminators, to give us the opportunity to make meaningful comparisons between applicants. That I think the things that are easy to anchor on, like boards, but ultimately less helpful. And I think when you ask program directors as a community and clerkship directors, when this comes up on our listserv and at our conference, this is continuously the highest ranked thing in terms of the importance in the application. So this is basically what the letter looks like, all right? Who is the letter writer? And we're going to talk a little bit about the references provided by Box in a little bit, and where it says present position, the group SLOE is very important, and we're going to talk about that in another couple of slides. But this asks the basics, what what was the grade the person got on the rotation? How did you know them? How long do you know them? Like I talked about, but also in, when it comes to trying to know the site, it's going to let me know, does everybody who goes to this site get honors, or does almost nobody get honors? So the fact that you were able to get honors and only 5% of people from that rotation get honors, that puts a lot of weight on that grade, and it's the context that we need. Now, I'm not going to go through all these, but this is my plea to go to the CORD website, all right, cordem.org, and download this, the example, the FAQs about the SLOE, and take a minute and look very carefully about the qualifications, the B section. Because as we were talking about, what one of my mentors used to refer to it as roundsmanship, all the things from the last talk, these are the things you need to be paying attention to, all right? Did you think out your career choice? What is your work ethic? How do you work with a team? The ability to communicate a caring nature, all right? You can't change a lot of things that happened in med school, but you can change how you, cue yourself for the things that people are going to be looking for. You know the questions to this test. All right, it's a matter of how you put your best foot forward and how you put yourself out there. The global assessment is important because this gives the letter writer the opportunity to say, top 10%, this person is a rock star. I will say, don't be alarmed by the mid to lower third. And there's a ton of discussion that happens amongst academic EM people, because we recognize that lower third doesn't mean you're not going to be a good doctor. It just means compared to the applicant pool, how do you suss out? Are you the top 10% of the applicant pool or the bottom third? Personally, this is my editorialization about this. I despise this because I think that unless the letter writer puts a lot of context in the box on this next page, it's really hard to tell. I might say that someone's middle third and say, that seems like, ooh, middle third, that's not good. But when I write in the narrative and say, this person is a hardworking, honest person who's going to be a solid, no-risk person for your program, that's a really good bottom line that other program is going to want to know about. Not everyone is going to be top 10% here. Not everybody is going to come home with the same trophy. Hopefully all of the trophies say emergency medicine on them. But again, this is, the narrative that comes up is going to be the part that says, she was a great student to have in the rotation. She, came early, stayed late, was always asking residents if they could help, and et cetera. So this is the context for the letter that we talk about. Now, I think the question about getting a SLOE from a community site that does not have learners in it and doesn't know what the SLOE is tends to not be a good idea, because the letter, it's just not the right context for it. We could talk for an hour about the pros and cons of that. But what has changed in the past couple years is that there are different kinds of SLOEs, all right? When we think of the prototypical letter, there is a SLOE by program staff, clerkship directors, and a place with an ED residency based on your rotation. However, now there's also the opportunity, if you do an EMS rotation, ultrasound tox, to get them to write a SLOE, all right? But I'm going to back up because I want to point out to you the box up top that says nature of contact with the applicant. All right, so they're going to say, other, EMS clerkship director. Now, the biggest thing that you can do to improve the impact of that EMS or ultrasound or SIM letter is to take the initiative to spend time with that person in the emergency department, all right? Work with them clinically, work with the letter writer clinically, because that will let them say, they were primarily here for an EMS rotation, but they took the initiative and they worked with me on 2 shifts, and I think it was awesome having her in the emergency department with me. That is the biggest thing that you can sort of do to improve the value of one of these sort of non-primary clinical rotation, a subspecialty rotation SLOE. Now, when it comes to that other box, we talked about who the letter writers are. By far, the letters with the highest impact that are going to be taken most seriously is that committee SLOE. So the program director, especially if there's an associate program director and the clerkship director in it, is really valuable, because what that says is that in this letter there is 50 years of experience with medical students. They've seen this person's performance from multiple different aspects, and if they say that you're awesome, the likelihood of you fooling one person is not that high, but to fool 3 people, much harder. All right. So this is really the gold standard letter. Now, sometimes, especially if you're only going to do one rotation, all right, getting that second SLOE is important. Or if, for example, you did an away rotation and you worked with one of the assistant program directors who is not writing the committee letter, some places will allow you to ask for a second individual letter of recommendation from faculty or residency leadership or someone of consequence in that department. Especially if you worked 10 shifts during that month with one of the assistant program directors who doesn't write the committee SLOE, there's going to be significant impact in getting that second letter from that rotation, because they're going to be able to say, please refer to our larger departmental letter, but I'm writing a separate letter because I spent a ton of time with her and she's dynamite. I loved working with her and I'm recruiting her to the program. That says an awful lot about how your rotation went, in addition to the committee letter. All right, some people also will get a department chair SLOE or a solo faculty SLOE. I will make the case that sometimes this varies by the program. I would much rather get a letter SLOE from a faculty member who worked with you clinically and knows you and can speak about your strengths and weaknesses than like the chair with a name who didn't work with you in the emergency department and says, from what I've heard, they're basically a nice person, but I can't really say, so yeah. Those letters tend to not be that helpful. And the purely non-clinical SLOE, if you do an ultrasound rotation and you're nice, that's great. But again, trying to move that subspecialty EM letter up the hierarchy by doing some shadowing and especially showing that you're putting the initiative in to spend time in the ED in that site can be quite valuable. So in most rotations, you're going to get that letter offered to you because everyone knows that's why you're there. All right. But sometimes, as I mentioned, you'll have that opportunity to make those individualized requests. When you make a request, all right, especially if an individual letter writer, it's the same thing that you're doing when if you have a space for a 4th letter and you're going to ask your primary care longitudinal person who's known you for all 4 years of med school to write you a letter. You say to the person, do you think you could, would you feel comfortable writing me a letter of support for a SLOE? And this is, they talk about micro expressions and in micro responses in cognitive psychology. If the person turns and runs away, or they hide under the desk, or they hesitate, that means there's something that means you should think about asking someone else. Either they've never written a letter before and they don't know how to do it, or there's something, but just take that response to heart. If they say, I think there might be someone better to ask, think about that a little bit. Again, 85% of the SLOEs that we read are just, all right, you rotated with us, you're getting the committee SLOE, and there's not much to say about it. But again, even if it's later in the season, as the last speaker said, I strongly urge you to get that letter, even if it's a late letter and you in December are writing the places that you are interviewing saying, or the places you've applied that you're waiting, saying, I just want you to know this letter came out late, but you're far better to get the letter late than to not get it at all, because then people are going to say, well, what happened in that rotation that there's no letter? It's definitely a red flag. The non-EM letters are the way I say it, the icing on the cake. You do not need to have these, but as a 4th letter after you have 2 SLOEs, can be nice to say, again, the likelihood that you're going to fool somebody over 4 years of a longitudinal office experience or a research mentor that you had, or someone who can really speak meaningfully about who you are, that has known you for a long time, can have some value, but it does not take the place of a SLOE. All right? And this ideally is a person that you've shared your experiences with, and they are going to say, this person, I'm a primary care doctor, but you know what? This person can be an awesome emergency physician because she can walk into a room and make a connection with someone in 15 seconds. That's a valuable thing for me to know about you, even though it's not coming from an EM person as that icing on the cake. And again, just to hammer that point home, you want that letter to really be specific about your attributes, to be emergency medicine specific and not be this person is nice and could do anything. Not a helpful letter. But when you have the opportunity to ask for one of these icing on the cake letters, the things that they say, like in this letter, again, I'll read the highlights for the folks in back. Outstanding, great fun and knowledge, genuine curiosity and enthusiasm, a person of integrity, very respectful and compassionate towards our patient and staff, excellent bedside skills. Anything that this person will do, they'll do with give 100%. They represent the best of our medical students. That has some oomph to it and can still be valuable. And again, similar letters, just someone who knows you and can speak superlatives about you, especially that sometimes it's even that surgical clerkship advisor who's like, are you sure you don't want to do surgery? What could I do to convince you to do surgery? That person is probably going to write you a good letter if you're looking for one of those extra letters, because when that person writes that letter, some of the most impactful things that they'll write in these letters is, they would have made an awesome surgeon and I tried to get them to go into surgery, or whatever it is. I tried to get them to go into family practice, but their heart is set on emergency medicine, and as much as it saddens me that they're not going to be in my specialty, I'm so excited that they're going to be an awesome emergency physician. That has weight to it. And even if it's a clinical non-SLOE community emergency medicine letter, sometimes these also can be helpful, because again, this is that thing where they will say, I want to hire this person after they finish residency. But it's got to be, don't ask the person that is in the group that you worked one shift with. Ask the person that knows you really well, that worked a bunch of shifts with you, and really can speak to those attributes you have, because that, in terms of what goes into the letter, makes all the difference. So the final pointers I have is, it goes without saying that the people who are the clerkship director and program director are people that have some prominence in the site, but I can't tell you that how often it happens that someone will do a rotation in the site and will never take the initiative to meet the clerkship director outside of work, or I'll work with them and they'll never say can we get coffee and talk. I have so much more detail because I want to help the people who rotate with us by and large, but if you get to know me, if you take that time, like the last speaker said, to say, I'm leaving tomorrow, today's my last shift, but I really loved working with you, can I ask you a couple of questions? You put that personal touch on that relationship, you're going to get so much more out of the letter, and it's such a missed opportunity to rotate someplace and not get a face associated with the name. Review that SLOE and work to fulfill those specific criteria. And the last tip I have is, everybody knows that, especially the program clerkship leadership know the deadline. They know you're trying to get the letter out there, but life happens. Family members get sick. Drama happens at work, and if the letter's not being uploaded in a timely fashion, there are nice ways to be a bit of a nudge. Call and say, look, or send them an email. I know it is a busy time of year, but I just want to remind you the ERAS opening date is coming soon. Especially if it's a home institution letter, drop by their office. This is not the time to hold back. bring their secretary a box of chocolate and say, remember me, I rotated in July, and it was so nice of Dr. Smith to offer to write that letter, and is there anything I can do? And sometimes just gently needling their admin person in a nice way will also help. But people know that this is this is a pretty tightly orchestrated thing, and in general are going to try to get the letter in for you. So if there are any questions, please feel free to email me. But if there's a minute or two,
so let's take one from the back.
So you mentioned, thanks. So you mentioned the non-clinical tox and ultrasound rotations. Does that include a peds EM rotation that would hopefully be mostly clinical? Or would that be a SLOE that's more or less equal with a regular EM rotation?
A peds EM SLOE would be more or less, that's a good question, would be more or less on footing with a regular SLOE, particularly if it's PDEM people from a place with a PDM fellowship. That's the highest, would also be in that high weight category for sure. But we do want an adult EM SLOE in addition.